Otitis Media. Introduction. Please point to the tympanic membrane. Choose one of the following options. Correct. The inner ear is responsible for hearing and balance. Select true or false. Correct. Please point to the eustachian tube. Choose one of the following options. Correct. The eustachian tube connects the middle ear to the upper part of the throat. Patients with otitis media have trouble hearing because of the fluid behind the eardrum. Select true or false. Correct. As fluid accumulates, the person may have trouble hearing because the eardrum and middle ear bones are unable to move as freely as they should. Otitis media affects only children. Select true or false. Correct. Middle ear infections can affect people of all ages. However, they are more common in children. Almost 50% of children will have 3 or more ear infections during their first 3 years of life. Otitis media can only cause temporary loss of hearing. Select true or false. Correct. Although the hearing loss caused by otitis media is usually temporary, untreated otitis media may lead to permanent hearing impairment. A doctor can quite easily diagnose a middle ear infection. Select true or false. Correct. Using an otoscope, a doctor can easily diagnose a middle ear infection. Some bacteria that cause middle ear infections are resistant to certain antibiotics. Select true or false. Correct. When a child is given a lot of antibiotics for other diseases, certain bacteria can become resistant to the antibiotics. That is why antibiotics should be taken only when prescribed by a doctor. In addition, antibiotics should not be taken when a virus, such as a cold or flu, causes the disease. The purpose of a myringotomy, an ear tube operation, is to both equalize the pressure inside and outside the eardrum and drain fluid. Select true or false. Correct. It is easier for fluid in the middle ear to clear out with the tubes in place. Which of the following activities increases the risk of getting a middle ear infection? Choose one of the following options. 1. Breastfeeding. 2. Antihistamines. 3. Being around smokers. Correct. Being around smoke seems to increase the likelihood of getting a middle ear infection. Thank you for using Explain.